I'm Beth Miller, and this is my 5-minute lecture on precocious puberty. So this is the appearance of secondary sexual characteristics before the age of 8 in girls and 9 in boys. There are 3 different types. First, you have gonadotropin-dependent precocious puberty, or GDPP. Usually this is an idiopathic cause, but can also be caused by central nervous system abnormalities. This is when you manifest secondary sexual characteristics in harmony, so you have multiple symptoms presenting at one time. Secondly, you have gonadotropin-independent precocious puberty, or GIPP. This is normally caused by tumors or cysts in the hormonal organs or exogenous sources. And this is when you do not manifest these characteristics in harmony, but normally you just have one presenting symptom that's related to puberty. Then finally, you have incomplete precocious puberty. This is not an environmental cause or a pathological cause. This is just this child is entering puberty early. So risk factors, it is more prevalent in African American children, and it is more common in girls than in boys. Also, if the child is exposed to exogenous sources of hormones, they are more apt to develop this condition. So what are we going to talk about and screen for when we look at working up for this condition? Do you have features of puberty? This is something we will look at to determine if they are indeed in precocious puberty, and also what type. If it's one symptom, most likely we're looking at the GIPP. If they're having multiple in harmony, we're either looking at the GDPP or incomplete precocious puberty. What features are we looking at? We're looking at breast or testicular enlargement, appearance of pubic and or axillary hair, acne, or adult body odor. We also want to talk about how quickly have these puberty symptoms developed and when did these symptoms start. When you look at how quickly they've developed, you're looking at, is it just one presenting symptom or is it multiple at one time? And that kind of helps us determine the type of precocious puberty they are in. Also, it helps you determine, is this an acute change that is developed in an acute response, or is it a chronic abnormality that has kind of developed into a slow progression into puberty. Further, if you can pinpoint when it actually started, you can look, is there a pathological change or an environmental change that happened at that time that could have precipitated this presentation. On your physical examination, you want to look at height, weight, and height velocity. This is important because in that first type of precocious puberty, the GDPP, the biggest risk is related to premature closure of the epiphyseal plate, so that keeps that child from growing as tall as they normally would have. Then we talked about that the central nervous system pathology can be a cause for precocious puberty, so you want to complete a thorough neurological exam. And then finally, most comprehensively, you want to look at the sex-specific puberty features that are present. Is there one? Are there multiple? That helps you determine the type. If they're present at all, that helps you kind of confirm the diagnosis of precocious puberty. You want to use Tanner stages for breast and pubic hair in girls, and then you want to measure testicular volume and penile size in boys. You'll use your follicle-stimulating hormone and luteinizing hormone from a lab perspective to look at this diagnosis. On your lab work, in your GDPP, or that first type, you will have pubertal levels of these hormones. Whereas in your GIPP, or your second type, you will have, also the incomplete precocious puberty, you will have prepubertal levels of these hormones. So treatment, the only time that this would really be appropriate is in that first type, that GDPP, and that's because of the risk for premature closure of the epiphyseal plate and not allowing the child to develop skeletally as they should. So we might give a medication for that. Normally you would watch the child from 3 to 6 months before you started that. In GIPP, you want to just treat those underlying conditions, whether it's a tumor or a cyst, or removing those exogenous sources. In incomplete precocious puberty, no therapy is appropriate. This child is going naturally into puberty, and you would treat them just like you would an adolescent that was in the same situation. Patient education is a huge component with this diagnosis. Certainly you want to talk to them about the manifestations to expect and appropriate lifestyle modifications, whether that be the introduction of using a bra or safety with using razors for shaving, that kind of thing. Certainly as you give that GnRH agonists to allow that child to have skeletal development, you want to explain the reason for that medication to the parent. Potential complications, probably the biggest one is the psychosocial stress on the child. I mean, they've got body changes that their peers don't have. And so you want to give therapeutic communication and really good support to that patient and their guardian, and y'all work together to help that child work through that. And these are my references. Thank you.